Hi, my name's Andy, and I'm here to talk to you about hygiene. Hygiene is collective principles of health preservation. You may be saying, Andy, wait a minute, that sounds kinda hard. But it's not. Listen to these keys for a nice and good hygiene. Bathe and shower every single day. If you don't, it's disgusting. Keep your hair clean and out of your eyes, especially if you're doing massage therapy. Wear clean clothes every day. Put on antiperspirant or deodorant. Brush teeth 2 times a day and floss at least once. And keep your living environment clean. Okay? Human hands are a very common way of transferring pathogens. That is why that hand sanitization is of the utmost importance. Here are some things that you should wash your hands after doing. Before and after food preparation. Before and after using the toilet. Before eating. Before inserting and removing contact lenses. Treating wounds. Handling something that may in fact be contaminated. After sneezing and coughing. And always use alcohol-based hand sanitizer. Next thing I'm going to show you is how to wash your hands. So come on to the sink with me. Alright, the first thing we're going to do is get the water running. I'm just going to wet your forearms and your hands. Lather it up. Then you're going to use some soft soap. Work that into your hands, on your forearms. Make sure to use soft soap because it has less bacteria than hard soap. Next thing you're going to want to do is create a lot of friction in your hands, get in between, get on the back, even get your wrists. Get in between your fingers, and then wash it off. This process should take about 15 seconds. Just let the water drip off your elbows. Then I'm going to grab this paper towel and rinse. Dry it out. And then use the paper towel to turn off the faucet to avoid cross-contamination. And then dispose of the paper towel.
Lisa, we need to talk.
What about, doctor?
You failed to notice the contraindications on your last patient and gave him a massage anyways.
I'm sorry, sir, but what's so bad about me not noticing those?
Well, that last client had the herpes simplex virus and was clearly contagious.
So you're saying I'm infected?
Most likely, Lisa, yes. Now, don't you feel like it would be a good idea to learn about contraindications and diseases?
Boy, do I ever. Let's get started.
Let's start off with something simple. Do you know what a contraindication is?
Well, of course I know what a contraindication is. It is a presence of a disease or condition that makes it unsafe to treat a particular client in the usual manner.
That's right. And when a client has a contraindication, it is either a local contraindication or an absolute contraindication. Can you give me some examples of local contraindications, Lisa?
If a client was recently injured, an area is inflamed, or excessively tender when pressure is applied. Also, if a client has a lump, lesion, suspicious mole, or localized skin rash.
Right again. When a client has a local contraindication, it is okay to administer a massage providing that you avoid certain areas of the body. The other type is an absolute contraindication. Examples of these are a client with widespread infection or inflammation, a disease that is in exacerbation, a client who is in a state of medical emergency, a client with a fever, or contact with a reported disease that is highly contagious. Moving on. Considering the recent events, I think it is important for us to also talk about disease transmission and infection control.
You are probably right.
Disease transmission occurs when pathogens travel from a source to a host. Transmission can be by direct contact, vehicle or vector transmission, or inhalation of infected respiratory droplets. Now Lisa, how do you think you contracted your disease today?
Probably direct contact.
Lucky guess. There are 3 types of direct contact: mother to fetus, animal to person, or in your case, person to person. Vector transmission occurs when infectious organisms are transmitted in or on a common vehicle or source. Vector transmission involves stings, or bites from insects, or animals that act as intermediaries of disease exchange between 2 or more hosts. Can you tell me what transmission via respiratory droplets is?
I think so. Wouldn't that be like when a person coughs or sneezes and the spit ends up being breathed in by someone else?
Well, that is a little blunt, but for the most part, you were right. Finally today, I would like to talk to you about infection control. There are many ways that you can unknowingly become infected during a massage with a contagious client. You may unknowingly touch an infectious rash in a treatment room with poor lighting and spread the infection to another part of the client's body. Infection can also be spread through contact with contaminated linens or other materials. In the 90s, the CDC published guidelines for healthcare providers called Standard Precautions. Standard precautions for massage therapists like us include hand hygiene, using disposable gloves, appropriately laundering contaminated linens, disinfecting massage materials and lubricants, and personal hygiene. In addition to these, there are a few easy ways to break the chain of infection. You can remove the infectious agent via hand hygiene, disinfecting contaminated areas, and so on. You can also create a barrier against disease entry using gloves. Always remember, the first line of defense against disease is your skin. So be sure to keep yours intact and practice proper glove use if you have a cut or open wound on your hands. Well, judging by how you're falling asleep, I guess that is a good point to stop for today. I hope you learned your lesson about properly dealing with infectious diseases.
Oh, I have. I'm sure this is a lesson that I won't soon forget.